Ooh.
Oh,
when he does the sign a thing.
no, I
Oh.
think that'd be a different. You need a better teacher. That's moving.
Boom.
Here we go. Let's do it. Monday. LT's.
I'd choose Benji Santiago.
There you
yeah,
go.
you can't go wrong with Uncle Benji, right?
Yeah.
807 LT. So I guess just we want to give you the floor. Let us know all the things that you guys are working on, and then we had some questions. So just go ahead, take it away, Lieutenant Governor Josh Tenorio.
Well, I just again thank you for the opportunity to come on the air, and I think the number one I think people are looking at is what's the where things on with all of the different relief packages, and so one thing I would like to say is that this payroll protection program that has just run out of funds, but it looks like the Congress is coming up with a negotiated agreement to push more money into SBA. But I can tell you that prior to closing the funding, there are already 508 employers that have received $102 million in grant funds from the SBA. Of course, 3/4 of this are there to provide payroll protection for employees. I don't have a list of the 508 employers. I'm not sure if I would have access to the list.
Yeah, I'm not sure if we want to read it
right?
either.
But I think that's one thing. And the other thing is there have been now 1,200 additional residents or households that have been approved for public assistance programs as of Friday. And that
Wow.
Sorry, say that again. 1,200.
1,200 new households have been approved for public assistance programs.
Okay.
Not all of, and there's different, everything from MIP and Medicaid to food stamps. But there are now about more than 7,600 households that are now getting SNAP. So there's different things coming down. This morning and the next few days, we'll be keeping our eye on implementation for unemployment. And I know that they've been working over the weekend trying to get everything on board to get ready for that pipeline. And of course, last week, that there's more than $10 million that have been fronted for the rebates by Daphne Shimazu, and I heard she was on your show and letting you know about that a few days ago.
Right.
And in terms of the testing, I just have to say that there's a big nationwide, worldwide concern with testing, and I think that what's going on is people are in the medical group and at public health are working on a transition plan to expand testing. But I think one of the more, hot topics are these PCR tests that do the nasal swabs that we've been relying on are in high demand, and then there are these new tests coming in from off island, or opportunities to get them in from off island that are not yet approved by the FDA. And I know there's a lot of reading and there's a lot of public discussion about that, but I just would say that the goal is to expand testing, and I think that over the next few days you'll see that there'll be some additional. We've received a couple of these new Abbott fast testing machines, with more in the pipeline, and so I guess we'll learn more about that in the next few days.
Is the issue that we have the machines, we just don't have the test kits? And
that's always been there's always big picture view, identifying all the test kits and the cartridges that are needed and timing them so that they're available for immediate use for the sickest of the residents coming in, and then made available for all of the different testing priorities. But I would expect that there's going to be expansion of or kind of a refresh of the testing priorities based on the kits over the next few days.
Right. Yeah, I was just kind of curious, like, why we were only seeing the 7 and the 9.
I think everybody's kind of wondering that. LT, what would you say to that?
So that part of that is we're in the middle of expanding testing. So the testing protocols that were developed in consultation with CDC and HHS based on the supplies
Right.
were there. And now that we're seeing a very optimistic signs, some of the optimistic measures that we see and we track every day are the number of hospitalizations and, the number of recoveries. And I think that since last week, the governor has asked the physicians group and public health to do a pivot, and based on the stock that we have and the stock confirmed to be in the pipeline, to make that expansion.
Mm-hmm. So it's not just test results that we're looking at to determine how we're doing. We're taking into consideration the hospitalizations and the recoveries. And
That's
that all
right.
plays a factor.
The hospitalizations in particular, and the number of people that are in different levels of care. And I'll just maybe I'll say that some of the other things going on is there's been a movement of patients around so that we continue to be able to move and respond to more patients if another wave comes. And we're hopeful that another wave does not come based on the signs and based on trying to make sure we reduce the amount of the potentiality for community spread. But I would just say that I would, looking at this the last few days, I'm very cautiously optimistic, but I also realize that this is also a critical time. You know how it is when in all sorts of things in life, things look great and you start doing things and all of a sudden you get hit. And I'm always leery that that we need to just be very cautious, but keep moving to try and expand testing capacity, but then also look at incremental ways that we could try and return life to, the new reality that we'll probably find ourselves.
Are you aware of how soon we're going to see these alternate care facilities go up?
Well, there's actually a wave or a plan. So what happens is that there are I think there are 4 or 5 stages, and everything, and the trigger point will always be 80% occupancy of whatever system they're in. So, for example, if we're already at 80% capacity at Guam Memorial Hospital, including the skilled nursing unit of active COVID patients, then a next phase will come in, and those phases include, using the surgery center, and then further down 3, 4, there are always plans to respond to what the reality is. So they're all triggers that are in place, and then they're all coordinated between us and our federal partners and U.S. Army Corps of Engineers, the National Guard. But really, all of these stages are developed by our medical group, which, as you know, is being led by Dr. Mike Cruz.
So we understand that 7 site assessments were conducted, and so the final 2 have been selected. Where exactly are these alternate care facilities going to be located?
Well, alternate care facilities, later stages. I think that they're finalizing the action report, because part of these also include stepping up of some military assets, and in the next few days, and those would preempt having to utilize some of the other areas out there. But I tell you what, Sabrina, I would feel more comfortable having that come out from the surgery group, because, as you know, things can change in 24 hours, and I want to make sure it's accurate.
Right.
Yeah, because I had seen the representatives from the 254th Red Horse Squadron. I saw the pictures that they were over at the Guam Memorial Hospital just over the past weekend, and I was wondering if you had any information about that.
Well, part of that is I know that at least over there, do you recall or if either one of you have covered some of the press conferences, or on the top floor of the hospital, there's a large classroom, and that basically is, what they've been doing is they've been assessing and maximizing the use of all spaces. So it's probably meant for taking a look at that top floor and converting, and the plans to convert into a ward, things like that.
Oh, they were actually outside, and they had their little measurement things.
Looking at parking lot.
Yeah.
Probably. Yeah. Yeah, so the parking lots have been looked at to see whether or not for fitting for capacity of emergency medical assets like mobile hospital. And you recall back in Typhoon Pangsangwa, there actually was a military field hospital on the parking lot of GMH when GMH was severely damaged. So those are all kind of like all the big picture pieces, and like I said, they're trigger points. And then I'll speak to the medical group in a few minutes and see where they are, and then find out when they would give an update to you guys in the next few days once everything is finalized.
Okay. What about?
But the bottom line, I think, is that it's making sure that we have capacity, making sure that if we need to identify or order equipment, that's already ordered, and we're ready to move in case things turn for the worse.
What about the homeless population and addressing where they're going to be located? We haven't heard a whole lot about it from the administration for several weeks now, and I know that the mayors, they spoke with the governor through a Zoom conference last week. And they're not quite sure when exactly they're going to see this temporary facility. There's talk about it possibly being at Paseo. Is there any new information?
Yeah, so the Red Horse Squadron of the Guam Air National Guard have been out there doing their and have been basically coming up with a plan, an actionable plan that is currently in progress to make improvements, or I guess repairs, to shower facilities, making sure that they come up with a very good management plan. In the last few weeks, and definitely in the last week, there's been work being done by Guras Ray Tapasnia with the Homeless Coalition and the private sector partners to identify the method. There are 4 nonprofits right now that get regularly about $1 million in homeless feeding and emergency shelter monies. And the instruction from the feds were to use those pipelines or integrate those pipelines, and what the response was. And, several weeks ago, we thought that we could probably just open real quickly a congregate facility, and then seeing some of the problems that have occurred in some of the bigger states when they've done that, it had us really put a pause. But I would just say that that's a big priority. A lot of work. There's a committee working on that right now, and I think that they'll probably give us an update on strategy and their operations plans today. And I'm pretty certain the governor will be giving an update over the next few days on that. There's big pressure to get that open, but making sure it's done the right way.
Right. So what's been the holdup? Is it just
does it have
federal?
Anything to do with the reimbursableness of it, or are we just trying to stand up?
No, it's just trying to make sure that we have the proper place and that we have the manpower to open it. So some challenges have been, not having the capacity to operate that while we're concurrently operating quarantine and isolation. And now that we're seeing, good progress with recoveries, including snail's pace or trickling in of the number of inbound passengers through the airport, we're able to really go in and utilize the resources to come up with a proper plan. And I think we're going to be very aggressive in the early part of this, but seeing some of the problems happening in the states, including where they inadvertently created a whole bunch of clusters in some of the states, and trying to make sure that we don't get into that same position.
Okay. LT, I guess, Bree, you got anything else?
I don't know. Is there anything else, Josh?
He's like, no, there's nothing else.
But it's not our last time, so, I mean, I'm glad that I'm going to be working, on speaking with you guys a lot more. And
nice.
Looking forward to your continued coverage. And just wishing I just like to mention to the kids and the parents that today, it's not your competition, but it's public television. DOE has collaborated with us to bring some school lessons to the kids using TV.
Yeah.
And I think that one of the new realities is trying to really revise what the strategy will be for educating our kids, and maybe giving some tools for everybody that's at home. I know that it gets stressful sometimes, but somebody said, I'm always one of the optimistic people, as I told you, it's your time to hang out with your kids, and really try.
Usually the people who say that don't have kids, though. And they say it like that. They're like, yeah, hey, you can spend time with your kids. Yeah, you come spend time with them, bro. Drive me crazy.
I was on the phone with my sister's son, Dylan, very close to him. I was asking him, I said, Dylan, are you going to get your suitcase and come to my house and move with me? And he told me, he said, no, after the COVID. I said, after the COVID, you're going to move with me? He goes, no, I'll visit you. I don't want to move out. Oh, my gosh.
Okay, I hate to, I know we're talking all nice and stuff, but I wanted to follow up on something because I did remember. It had to do with when we last talked about the Department of Corrections and the release of pretrial detainees. Then later on, we heard that there were the book and release and notice to appear that the AG was, and their prosecutors were approving. So what is the latest with the Department of Corrections?
Well, I don't really have much latest except that, there was when CDC had been up there already and Public Health has been up there doing their surveillance work because of the corrections officer that had tested positive. And we're fortunate that, at least as of right now, a little bit before 8:30, I've not gotten any reports or concerns about any causes for concern with the detainee or inmate population. But I'll just go back and say that always prosecutors, police, judges, they have to use their discretion to make decisions on release. And, if somebody is chronically involved in the system and does violence, then I don't think that they deserve to be released. It really should be, and maybe one of the things that we can move to after all of this is detentions really should be based on what the public safety threat to the community is. There are a lot of different systems in place. We're definitely not there yet, but I'd like to get us there. I would just ask the prosecutors and police be very careful, take a look at the backgrounds of folks. And, at this time when people are at home and on edge, they don't need to be worrying about additional crime in their homes.
Thank you.
Yeah.
That's basically what it is.
Yep.
All right.
Okay.
Thank you guys.
Yes.
Thank you,
LT.
Okay, talk with you soon.
Okay.
Wash your hands.
Be safe.
Yeah, wash your hands and don't kiss anybody.
Okay, thanks. 8:25, Lieutenant Governor Josh Tenorio. So the commitment has been made. He'll be calling in every Monday. So if you guys got any questions that you got or you want us to follow up on, please put that in. I think he kind of hit all the bases there. Talked about FEMA
Testing.
and the testing and
DOC.
what their idea and what their plan is for mass testing. And
homeless population.
And the homeless population, right. So it's 8:26. We'll take a little break.